On our health report tonight, another case of trying to get the insurance companies to pay for a medical treatment that some people think is just the ticket. In this case, a procedure to unblock clogged arteries that does not require surgery. In fact, the easiest way to understand what happens is to imagine what Drano can do to a clogged pipe. Not everyone in the medical community is sold on this experimental therapy, but a growing number of people are. And here is ABC's John McKenzie.
For Alan Hay, the memories are also vivid. He was 51 years old and about as rugged as they come. He owned a guest ranch in Montana, worked as a trail guide, and ran a logging business. Then a heart attack 2 years ago brought a sudden and profound change.
Just the normal, everyday things that you take for granted are suddenly gone. Just walking, getting out of bed, climbing upstairs was very difficult.
So Hay signed up for a controversial treatment to open his clogged arteries. It is called chelation, a therapy now so popular that 500,000 Americans use it each year. It's an intravenous drip that passes through the arteries, removing calcium deposits that contribute to clogging.
With chelation therapy, we're able to increase blood flow and then reduce the need for medication and surgery. So therefore, there are fewer side effects and complications.
A series of 20 chelation treatments, that's about the average, can cost a total of $2,000. The problem is, insurance companies won't pay for it. Although chelation has been approved for ridding the body of heavy metals such as lead and mercury, it has not been sanctioned for use in heart disease and the opening of arteries, even though many patients report profound benefits.
The questions can only be answered scientifically. And I think physicians simply recognize that there are not substantive, meaningful studies published that demonstrate it is effective.
We're going to go even 13 minutes.
But Alan Hay and his doctor are convinced. After 20 chelation treatments, he completed a rigorous stress test.
After a heart attack, you expect the function of the heart to be abnormal, and in this case, his heart looks like it didn't even have a heart attack.
Is that unusual?
Very unusual.
I feel better now than I did before I had the heart attack, to be honest with you. I'm in great shape.
These cases are now common enough that some doctors say it's time to finally put this treatment to the test with a large, tightly controlled clinical trial to see whether a relatively simple therapy is actually responsible for some remarkable recoveries. John McKenzie, ABC News, New York.
If you'd like some more information about this subject, you can contact us at health@abcnews.com.
The world of so-called traditional medicine is far from accepting of the idea. Tonight, in the first part of a special Desert Health series, I take a look at the controversy over chelation therapy.
This is Howard Shelby's foot. He's happy to show it off.
It's healed.
But this is how it looked 2 years ago. The long-term effects of diabetes had shut down blood flow. Doctors offered little hope.
Their alternate was to take the leg off.
That's when Howard turned to this. It's called EDTA, a synthetic amino acid. Patients line up at this clinic to get it. Diluted and infused into the vein, the treatment is called chelation therapy. It was first used to treat auto plant and shipyard workers who had been exposed to high levels of lead in paint. It got rid of the toxins and won FDA approval, but with extreme restrictions. The agency's official statement: intravenous chelation therapy is approved by the Food and Drug Administration only for physician treatment of heavy metal poisoning. And that's where the controversy over chelation therapy lies. Most of these patients have a history of heart disease, strokes, or other conditions where blood flow is limited. They're relying on chelation therapy to improve circulation by removing calcium and other deposits that can clog important vessels. Eddie Patton was only 43 years old when he had open heart surgery, but it didn't help. He was on countless medications, fighting for his life while he waited for a heart transplant. In desperation, he tried chelation therapy.
After 8 treatments, I threw all my meds away, not at the direction of the doctor, but that was a choice of my own, and I could tell a dramatic change then, and it progressively got better.
Countless others share Eddie's belief that chelation therapy can help fight symptoms of heart disease and other conditions caused by restricted blood flow. Latest medical studies show that 500,000 Americans have tried it. But despite growing visibility and a fair share of positive press, watchdog groups remain vigilant and ready to discipline. A spokesperson for the Medical Board of California says intravenous chelation therapy has been approved by the FDA for the treatment of heavy metal poisoning. Once approved, the medical board cannot restrict a drug's use in other areas. But if a physician deviates from the approved use of the drug, we may take action.
Functioning pretty well. Do you have any irritation or discomfort along there?
No. I have a scar on my leg where they took the vein for the graft, and my chest incision, of course, hurts a little bit. But otherwise, I exercise every day. I walk between 4.5 and 6 miles a day at a good pace, and I'm trying to exercise more every day and build up.
5 weeks ago, Charles Rosati Bousquet had open heart surgery. He says it gave he and his wife Veronica peace of mind that his heart problems were fixed. It's a procedure that was first tried in the mid-1960s. By the early 70s, it had become the fix to restore blood flow to the heart and the cornerstone of a multi-billion-dollar-a-year industry.
I do believe, unfortunately, that money has manipulated medicine, just as it has manipulated the tobacco industry, the oil industry. Anywhere there's a place for a lot of money to be made, you will find that situations can be manipulated, usually to benefit, of course, those who are more powerful and have the most money.
I'm just scheduling appointments for your next chelation treatment.
It's the financial clout of the heart surgery business that Dr. Sean Degnan says is holding back the approval of this procedure called chelation therapy. Right now, the Food and Drug Administration has only approved it for the treatment of heavy metal poisoning.
There is not a financial profit to be gained by anybody doing a multi-million-dollar study on something as quick and easy as chelation therapy, which can be done by any physician in a doctor's office on an outpatient basis. It doesn't benefit the medical industry to any degree.
Chelation is supposed to clean the arteries out.
But Dr. Charlie Schaefer says the reason chelation therapy has not been approved to treat the symptoms of heart disease has nothing to do with competition for patient dollars. Coming up Monday, we'll hear from Dr. Schaefer, who feels the data doesn't support the claims. Plus, Dr. Degnan introduces us to patients who claim chelation therapy saved their lives.
And they looked at...
According to Dr. Charlie Schaefer, this is the problem with chelation therapy. While it's been approved to treat heavy metal poisoning, he says there's not enough research to support its use for other conditions, like heart disease.
I asked our librarian here at Eisenhower to do a Medline search, which basically looked at the scientific experience with chelation therapy over the past 4 years. She was able to come up with approximately 40 references, of which none really showed favorable benefit of this procedure.
But Dr. Sean Degnan disagrees. He says studies do support the benefits of chelation therapy, but he says they need to be more extensive.
Many of the studies have been quite good. The major criticism would be that they're not large enough trials to where we can truly delineate out all the various aspects of chelation that are necessary in its application.
Uses that could offer patients considerable savings. For example, a full-blown course of chelation therapy aimed at treating symptoms of heart disease runs about $4,000. Open heart surgery, upwards of $30,000. Meantime, while controversy continues, health consumers have the final word. Like Dorothy Glass, she went through 3 rounds of open heart surgery, but was still having chest pain, referred to as angina, an irregular heartbeat, and mini strokes called TIAs. She was also so short of breath she had to sleep sitting up. Then she tried chelation therapy.
And initially I had 40 treatments, and after about 17 treatments, I was able to sleep on one pillow. Dr. Degnan told me he didn't think that the chelation would help my arrhythmia. I noticed one day it was gone. And after like 2 weeks of treatments, I didn't have any more TIAs. I don't have any more angina. It was just a miracle for me.
So what keeps the FDA from approving chelation therapy for more widespread use? Is it the influence of heart surgeons, cardiologists, and perhaps drug companies? These groups stand to lose if fewer patients need surgery and if they take less medication. Or is the FDA's reluctance based on lack of scientific study? And if more study is needed, who will fund it? Medical research is often driven by groups who see significant possibilities for profit. But since chelation therapy is less costly than many treatments currently in use, it holds less cash flow potential. Groups large enough to fund major studies may not be interested if they don't see big business in the future.